I sort of changed things up a little bit from the order of how they do it in the book. I did basic terminology first, and now I'm going to do introduction to pathophysiology. So the learning objectives for this section in Chapter 1 are fairly straightforward, I hope. I want you to be able to discuss the validity and reliability and levels of evidence of different types of research studies, and we'll go through all those. This is part of the PTA board exam review, so it's definitely something you need to know. I want you to be able to list the types of information that are usually included in a medical history, and I want you to be able to describe the different levels of prevention in healthcare and the role that physical therapy may play at the various levels. So, pathophysiology involves the study of functional or physiological changes in the body that result from disease processes. So we're going to start building on the knowledge of the normal structure and function of the human body that we learned in anatomy and physiology. So disease development and the associated changes that happen to normal anatomy and or physiology might be obvious, or they might be hidden with their quiet beginnings at the cellular level. So hopefully in A&P you got to look at some histological slides with normal tissue, and you can say, hey, that's normal muscle tissue, and then you can know what pathological muscle tissue looks like. So knowing what's normal first is a good place to start. So pathophysiology includes some aspects of pathology, the laboratory study of cell and tissue changes associated with disease, and the last part of this chapter will talk about cellular adaptations that happen with disease. In the terminology section, we talked about biopsies and autopsies, so a lot is found out by looking at the cell and tissue changes. So disease is really the deviation from normal structure or function of any part, organ, or system from a state of wellness. So homeostasis is the maintenance of a relatively stable internal environment regardless of external changes. So when homeostasis is maintained, good health is generally maintained. When homeostasis is not maintained, disease may develop. So under normal conditions, homeostasis is maintained within the body with regard to blood pressure, body temperature, fluid balance, etc. Frequent minor changes occur and our body's compensation mechanisms respond, and homeostasis is usually quickly restored. And we're not usually aware of these little changes taking place. When things get out of homeostasis, a lot of times that's when you need some sort of intervention to get you back into a state of homeostasis. So health is defined by the World Health Organization as physical, mental, and social well-being. Of course, in PT, we're largely concerned with the physical well-being of people, but of course the mental and the social come in as well, because you cannot separate the three. They all exist together. Disease is considered a deviation from the normal state of homeostasis, and even more to the point, it's a deviation from the normal state of homeostasis that requires intervention to correct. That's sort of the difference, is you can't correct it yourself. You need to have a medical or surgical or physical treatment that is going to help you get back to your normal level of homeostasis. So health indicators are sort of normal, and normal's in quotation marks for a reason, normal values that occur within a range of values and may vary depending on the technology used for measurement. So if you measured someone's body temperature with an axillary measurement or an oral measurement or a rectal measurement, or the one that you point the little indicator at their forehead, you might get different values. So during in the current state of things, when we go into work at the hospital where I work, there's a screener at the door that takes your temperature with one of the little forehead thermometers. So I walk to work, and if it's cool in the morning or when I'm going in, my forehead is cold, and I register at a lower temperature. So I always have them take it on my body somewhere rather than on my forehead, someplace that's been covered up. So I get a more accurate measurement. So normal values are going to vary among normal, healthy individuals. And actual values might be adjusted for factors such as age, gender, genetics, environment, and activity level. So well-trained athletes often have a slower pulse or heart rate than an average person. When I was, a long time ago, I was in EMT training in the 80s, and there was a guy who was a cross-country ski racer, and his resting heart rate was something like 46. It was really hard to take his blood pressure, too, because you had to wait for the next heartbeat. But his heart rate was that low, not because he had a disease process going on, but just because his heart was super efficient. He trained at high altitude doing hardcore cardio. So those little fluctuations, blood pressure usually increases slightly with age, even in healthy individuals. So you're going to take that into account when you're looking at health indicators. You're going to take into account the different adjustments that you might have to make. So because there are different adjustments from person to person, it's not really possible to say a single normal value for blood pressure or pulse rate. It's also important to remember that any one indicator or lab value has to be considered within the total assessment for the individual person. So a healthcare practitioner is not just looking at one health indicator to tell whether someone is healthy or not, or whether there's a disease process going on. So in terms of prevention of disease, we really want to be advocates for health improvement and prevention of disease as healthcare practitioners, and we want to be a good example for that as well. So in the book there's a chart that's the 7 steps to health. These are lovely things to follow. And these are actions that you can take on personally. Being a non-smoker and avoiding secondhand smoke, yeah, let's do that. It's a very good step to health. Eat 5 to 10 servings of vegetables and fruit a day. I got to work on that. I don't think I'm up to that 5 to 10. I'll go have some spinach after this. You want to choose high fiber, lower fat foods, and limit alcohol intake. Always a good idea. Physical activity on a regular basis. I think for a lot of us in physical therapy, that's our normal way of life, and we can advocate that for other people as well, because for a lot of people that is not their normal way of life. Protection from the sun, following cancer screening guidelines, doctor or dentist visit if any changes in the normal state of health happen, and following health and safety guidelines at home and at work when using, storing, and disposing of hazardous materials. So I've been saying since March that I'm probably going to end up dying of disinfectant poisoning because I'm disinfecting everything so much, but we'll see what really happens. So because pathophysiology requires the use of your knowledge of basic anatomy and physiology, because we have to have something to compare disease processes to, it also gives us a chance to review a lot of those systems. So as we go through each of the systems, we're going to do a review of anatomy and physiology. So that's why this class is called Anatomy and Pathophysiology for the PTA. It's not just one thing. So a lot of times we're going to relearn some stuff that we already know. So it's good. It's every time you review something, it's reinforcing it in your mind, and it's better chance that you're going to be able to retrieve it out of long-term memory. So in the book, there is really a huge focus on major diseases. There are a lot of other disorders that are included. They really provide you with exposure to a broad range of diseases. Does that mean I want you to know all these from heart? Absolutely not. I just want you to be familiar with them. I want you to be exposed to them. So if you had a chance to listen to my learning lecture on spaced retrieval, I talked about priming, where you hear something in a lecture or something, and then later on it comes up, you say, oh gosh, I've heard that before. So your brain is primed to learn that new information. So a lot of these diseases you're thinking, wow, am I going to have to remember the tetralogy of Fallot? No, you are not. But it's in there. It's in your mind. We've planted the seed, and then later on it might come up. So in the book, they like to say, prevention of disease has become a primary focus. I think we need to work on that and focus our healthcare efforts more on prevention and less on remediation. But day by day, right? So we are going to look at the physiological changes in the body as a result of disease. We're going to use our knowledge of basic anatomy and physiology. We're going to include aspects of pathology, structural changes caused by disease, and we're going to look at cause and effect relationships as defined by signs and symptoms to guide the study of specific diseases. So almost every disease we look at, we're going to look at what is the pathology, what's happening in the body, what is the etiology, what's the cause, what are the signs and symptoms, what are the treatments for these specific diseases. So that's sort of the framework that we're looking at. And then sort of one more step for us that's not really in the book, since this is a book for all healthcare providers, is how can physical therapy affect this particular pathology? So with the prevention of disease, we're trying to prevent the known causes and predisposing factors of specific diseases in the development of more effective preventative programs. So the idea is that we really want to get everybody involved. So maintaining routine vaccination programs is important. Participating in screening programs, community health programs, regular routine doctor visits. So as healthcare professionals, it is super important for us to maintain our routine vaccinations. You might not be as susceptible to a particular disease, but your patient, it sure is. And so it's your job to protect them. That's why I get my flu vaccine, to protect my 85-year-old patients from getting the flu. So I work at a hospital-based outpatient clinic, and we are required to get our vaccines every year. Up until this year, if you had a reason for not getting a flu vaccine, which there are some perfectly legit reasons for not getting flu vaccines, but if you had a reason, you had to sign a release form saying that you know the risks, you didn't get it, and you had to wear a mask every day during the officially declared flu season. Well, now it's all masks. So we're wearing masks, our patients are wearing masks, we're wearing masks in public now. So as all of you probably know, as of the end of June, in Washington State, masks are required in all public spaces. And we're just trying to prevent the spread of this disease that is taking up the whole world's resources. So prevention, remediation, all of it kind of goes into the program. So primary, secondary, and tertiary prevention, there's a box in the chapter, box 1.2, that talks about the different types of prevention. So primary prevention, the goal is to protect healthy people from developing a disease or experiencing an injury in the first place. So wearing a mask can be primary prevention. We're trying to keep healthy people from getting the disease. Education about good nutrition, the importance of regular exercise, and the dangers of tobacco, alcohol, and other drugs, that can be primary prevention. community health programs. I participate in some different community health programs. I do some advocacy work for Parkinson's in the community, speaking to Parkinson's groups about exercise and about pathophysiology and about the disease itself. I do a quarterly Better Living with Arthritis program through the hospital, where we talk about how to exercise when you have arthritis and how important exercise is in the program. And then within that same program, there's also a nutritionist and an occupational therapist who talk about nutrition with arthritis and devices that can help you live a better life, basically. So just those educational programs are really good. Education and legislation about proper seatbelt and helmet use is considered primary prevention. Regular exams and screenings, immunization, and controlling hazards at home and in the workplace. So, like in my kitchen, I have a fire extinguisher, and that's primary prevention. I'm trying to prevent getting injured when I light something on fire. And yes, it has happened, even though I've never had to actually use the fire extinguisher. So secondary prevention is interventions that happen after an illness or serious risk factors have already been diagnosed. And the goal of that is to halt or slow the progress of the disease as much as possible in its early stages. In the case of an injury, the goals include limiting long-term disability and preventing re-injury. So that is a lot of what we do in physical therapy when we're working with orthopedic patients. The Parkinson's and arthritis programs that I participate in the community, those are secondary prevention because we are working with people who already have the disease, and we're trying to slow the progress of the disease, or just help people live better with the disease. So another example that they give in the book is like a daily low-dose aspirin to prevent a first or second heart attack or stroke. So it's not really treating anything right then, it's trying to prevent future problems. Recommending regular exams and screening tests in people with known risk factors for illness. So if you know that a certain thing runs in your family, you might be getting more frequent screenings than someone that doesn't have that risk factor. Providing modified work for injured workers, so having light duty. And a lot of times in physical therapy, we end up having to educate employers as to what light duty is going to consist of for this patient with this particular injury. So tertiary prevention focuses on helping people manage complicated long-term health problems such as diabetes, heart disease, cancer, and chronic musculoskeletal pain. The goals include preventing further physical deterioration and maximizing the quality of life. So examples of tertiary prevention are like cardiac or stroke rehabilitation programs. That's something that we do. We participate a lot in physical therapy. Chronic pain management programs, also another physical therapy intervention. Patient support groups can be helpful with that as well. So these different levels of prevention, I'd like you to be able to know what things fit into a different level of prevention. So just to know the different types of prevention of disease. So really that's what we want to participate in as physical therapist assistants, is we want to help people either avoid disease or live better with what they already have.